Hi, right, okay, I've got 10 minutes to do a presentation that really is a 20-minute presentation, so I'm going to talk very fast, so please forgive me for that. I'm the Learning Disability Primary Care Nurse. There's Learning Disability Primary Care Nurses throughout Devon. And for any of you that are from the Dawlish, Teignmouth area, there's Katie Walsh. And for any of you that are South Brent, kind of Ivy Bridge area, there is Kelly Nixon. But you should find on your seats these leaflets. And on the back of here, it's all the details. So every area in Devon has got a primary care liaison nurse. There is normally only one of us, I might add. A learning disability is a significant impairment of intelligence and significant impairment of adaptive functioning and social skills, really. I'm not going to read the slides out to you. I'm going to assume that you're going to look at them and read them. I'm just going to give you a brief overview. So do people with learning disabilities have higher health needs? Well, yes, they do, because they die younger. But their health needs are the same as everybody else, but sometimes their health needs, they can have more needs if they've got complex medical conditions that are linked in with syndromes or genetic conditions. Why are they at greater risk? Well, risk of things like poor housing, not working, not having employment, general social deprivation, increased health risks with conditions, poor diet, lack of exercise, and actually, despite the rumours, obesity is not the problem with people with learning disability, it's actually malnutrition. And the obesity stats for Torbay are the same as the general population. Health promotion materials are not readily available, particularly actually in general practice. And all of you should have had bags come round, these picture of health bags, and in it you'll have a little pen where it gives you the information where you can get easy read information. And you've got a disc which has got 430 easy read documents on relating to health that you can use. And a picture of health has got funding for another year as well, so we can get materials that might help you from that aspect. Lack of basic care in the hospital settings. I am a primary care nurse, but we have a secondary care nurse called Ros in the hospital, and I put Ros's details on your chair as well. And I work very closely with Ros, but there is a big problem still in Torbay Hospital now. We've had 3 people that we've become aware of who have gone on to TEPS inappropriately, and that's just been this year. So, for example, we had a man go into hospital at moderate learning disabilities, 52 years old, not eating and drinking, cause unknown. So they put him on a TEP, and they didn't consult with the family as well. And that has happened, and that's recent. So there's still a lot of work to do with healthcare professionals in our roles. Big problem with flagging systems. It's all right. Sorry. There's always one, isn't there? Flagging systems are one of the biggest problems that we have. In the hospital they have PAS, in the community we have PARAS. If you're Devon Partnership Trust, which bizarrely I am, but I don't have it, you have Rio, and so on and so on and so on, and all you guys have got different data systems too. The information isn't shared, and because of data protection, I'm not allowed to go and sit with Ros and tell her of all the learning disabled people there are in the Bay, even though I do have that register. So we have big problems with communication and sharing of information. Communication is a big problem for people with learning disabilities as well, and how to communicate with people with learning disabilities, and that's a subject for another day, I'm afraid. Assumptions being made about people and lack of understanding. There's often delays in diagnosis and treatment, and I've been working with a gentleman about taking blood, which is needed because there's a query about prostate cancer. We started that piece of work in February. We've still not got his blood. That's a good example of how slow the systems can be. Diagnostic overshadowing. Somebody comes in, they say they've got knee ache, and actually the problem's with the head. And misreading of pictures and being given the wrong information, very common. Unusual symptoms, and lack of coordinated services. Record keeping can be very poor, and particularly in residential homes we're having some problems as well, that they don't always come in with the information that you need that is critical for you to do your job. We recognise that. Difficulties in funding, and I need to mention I do not do social care funding. I do not have any responsibility for social care packages. Please, please, please don't ask me, because I can't help you, because that's mainly the question that gets raised for me actually. Lack of care pathways in place where people with learning disabilities should be on something like the GSF register, that some of your practices you're not putting them on. I've talked about TEPs already. Failure to recognise pain. Pain's often very difficult to explain, communicate. We do have the Distat tool, and I meant to bring one with me and I haven't. It's really for carers and families to fill in, but it's very helpful to help with pain, and it's pretty much the only tool we've got out there actually. Lack of value, sadly, placed on people with learning disability, that people make assumptions and they don't respect somebody with a learning disability as much as they would respect somebody else. So a stigma attached to that. Sometimes people decide that it's not appropriate for surgery to happen because of the complications of after surgery and having to manage that. Barriers to the health service, etc. And again, I just want to mention about the Mental Capacity Act, that there is quite a lot of lack of knowledge still about the Mental Capacity Act. I'm in exactly the same place I was last time, so I'm still going to speed on through. The confidential inquiry into premature deaths came out earlier this year. It's a recent piece of research, and I think some of the stats, and I'm not going to read them all out to you, but I think they're quite shocking really, that nearly half of the deaths that were recorded were premature, and that men are dying an average of 13 years sooner than they should be, and women 20 years sooner. And that's here and now, and that's because we're not meeting the needs yet, the health needs of people with learning disabilities. So we need to improve on what we're doing. And in the Bay, we have the highest rating in the country for the annual health checks. But before we pat ourselves on the back about that, the annual health checks can be very varied, and the quality is varying enormously. And I've sat in on, not every practice, but some of the practices in the Bay, and I've really seen that. And I have seen some outstanding practice, but I've also seen some practice that needs improvement. I'm not going to read out the stats here, but you can see them, that we've got the stats again. But just point out that only 4 people that deaths were explored under this confidential inquiry had the Distat tool used for pain. What the key messages are is that actually the health areas of concern are being recognised on the whole by healthcare professionals, but often very late and often delays in treatment. And the big thing for you guys in practice is making reasonable adjustments, like doing the easy reads, and that's where Magda will come in a couple of minutes and talk about the app, where it can make a difference for the work that you do. But things like putting up posters that are easy reads, using this, really helpful. Just to mention about problems in Torbay, Choose and Book has been a big problem for us in learning disabilities. It doesn't allow for double appointments. It doesn't specify you need adaptations for appointments, so somebody might need a general anaesthetic instead of just local pain relief. So those kind of things it's not picking up, and the flagging systems at the moment it's not picking up learning disability, so that's a big problem. Mental capacity is really a big problem that we're experiencing in the Bay, and a lack of understanding about capacity. So again, if you guys haven't done your training, I thoroughly recommend that you do your mental capacity training. TEPs I've talked about, consent I've talked about, issues of GI I've talked about. So, as I've mentioned already, there's a huge variety of the quality of the health checks, and we need to improve on that. We do have this tool. It is very helpful. We didn't have funding, but I think I might have found some in the last day or two, actually. So the books will come out, and I generally bring those out to all the people in the Bay. I think the other areas, I'm not sure that you use this. In the back of these, you've got the health action plan that you need to complete. One of the problems we're experiencing is that normally there's a scribble in these, where actually it needs to be an actual plan that is reviewed and followed through with. You guys are not always recognising where there's need for desensitisation. So things like taking blood pressures and taking blood are the two key areas that we find that you guys, if you are experiencing problems with your learning disabled patients, that you need to come to us. Just remember there is only one of us for each area. So we do have a waiting list for that, but we do desens work. For you guys, for the annual health checks, that this is the document you should be using for your for how to do your annual health checks, and it does say 30 minutes with the practice nurse or healthcare assistant, 30 minutes with the doctor. I'm not going to get into arguments about time or anything like that, but that's what the good practice guidelines say. We are working with the cancer screening programme and the AAA programme, but there's further work to do, and the care pathway is not fully developed yet on that, but we are working with that, and all the primary care liaison nurses are doing that. For you guys, you need to really work on improving consultation with people with learning disabilities. So you have great consultation systems in place. I've seen some of them on the website. I know you've got groups. How many of you got somebody with a learning disability involved in your user consultation? As I've already said, improve the quality of the annual health check. Healthcare professionals, and I do come out to all the practices in the Bay and do an hour and a half to an hour, if you really push me to push it into that, learning disability awareness training, where I go a bit more into depth about the annual health checks, and that links in with your DES requirements as well. You also, within the practices, need further training, or some people need further training around Anti-Discriminatory Practice, Equalities Act and Mental Capacity Act. Families and carers need to be involved in partnership with you guys, and if necessary, advocacy. We need better, clearer commissioning, and I work very closely with our Learning Disability Commissioner, who's been recently appointed. Raise awareness about premature deaths, which I'm doing today, improved inspection, core standards of skills as well, and particularly working with residential homes with that as well. And I'm not going to read it all out. I'm just going to tell you a little bit about me and the other primary care nurses. We will help do a bit of this and a bit of that. We do bits and pieces. We will help where there is a problem. We will liaise. We support with communication. We do desens. We'll give advice and information, or we'll find it for you. Sometimes we don't get it straight away. We can support with capacity or consent, but we won't do your MCAs for you. But we can help you with that. Training and awareness. And all of Katie has already got her practice nurse qualification. Kelly and myself were on the practice nurse course. So if there's a small percentage of people that really are having difficulty accessing primary care, we can do those annual health checks for you. We don't want an influx of people. It's only for people where they can be very, very challenging, very difficult to access primary care, that we can come in and do that. So you've got your leaflets on your seats, and it's got our contact details there. Have you all got those? Because if anybody hasn't, there's a couple more leaflets around as well. So, just to sum up, mainstream health services, as it stands at the moment, they are still not good enough for people with learning disabilities, and we need to work together to help to improve that. Because people with learning disabilities must access mainstream services. They've got to be, we were in the past in these models of specialism, and we know all the failures with that. There is specialist support for you, but people need to access mainstream services, and it needs to be embedded in your practice. Okay, thank you very much. I'm going to hand you on to...
Thanks very much.
Thank you very much. Thank you.
Do you want the truth?
Right. Good evening, everyone, and thank you for coming. My name is Magdalena Wood. I've worked for the NHS for the last 5 years. Now I work as a contractor for NHS England. And my background is in race equality and mental health, community development, public health. And I'm here to give you a 10-minute presentation on a smartphone app that aims at supporting and meeting the needs of people with profound and multiple learning disabilities. It's a newly developed app You may not be aware of it because it hasn't been officially launched yet by NHS England, but it is coming your way in due course. So I'm here to demonstrate the app functionality, talk you through the process, the development process of it. So the aim of the app is just that, to make sure that everyone involved in care of an individual with profound and multiple learning disability to have access to information. In that case, an easy access to information when they need it, at any time. And so that in turn they can feel confident in meeting the needs of the person they care for. Just a little bit of background about who produced it and paid for it, sponsored it. So the app was produced in a partnership between the Strategic Health Authority Adult Safeguarding Leads, sponsored by NHS South of England, developed by NHS South Central. Now this is all under NHS England umbrella, and I was involved in the product and development of that app through my consultancy. All right, so a little bit of background to the app. This information, the top tips about supporting the needs of people with learning disabilities, is already available in a booklet form. They are being printed in vast quantities as we speak, and they will be available across the Southwest in a couple of weeks' time. They've been developed by the East Midlands Safeguarding Adults colleagues and been launched in other areas of England. It's in the format of a prompt card, so they're laminated cards, kind of color-coded like this, on a little ring that gives you, a nice kind of format to flick through and read through the top tips. Now, in addition to the booklet, for the ease of access, we developed the same information in the form of an app. Now, a smartphone app is available free of charge to download, and it is live now, so you can download it as we speak. It's available on every platform, which means it's available on Android phones, iPhones, Blackberries, and it's also optimized for Galaxy tablets. And I'll demonstrate the app to you and talk you through some of the chapters. So when you download it, it shows the menu. That's the screen you're going to see first. You will see here that it contains 6 color-coded chapters. The introduction contains 6 screens with the feedback link, and I'll talk about the feedback later on. And then you have 4 chapters, each contains a welcome screen, and then 10 screens with top tips. So you've got basic health needs, communication, eating and drinking, and information on postural mobility. It also has a chapter on useful resources, and the help area here that gives you information about how to use the app and how to change the screens. And if you press here, it gives you credits and disclaimer. So in total, 57 screens, all includes text, pictures, and web links. So in terms of the functionality of an app, it's pretty basic functionality, because there's much more that you can do with an app. But the aim of the app is a reference tool. So it's an information giving tool. Hence, it doesn't have all kind of fancy interactive things that you might see in other apps. If I talk you through an example, if you want to access eating and drinking chapter, this is the first screen with a picture. You will see the button there. Oh, you may not see it, but in the corner, upper left corner, there's back to menu screen that takes you back to the main screen. So this is an example of a screen, a tip on good nutrition. So it includes different tips, but also web links to access further information. So when you press that, it goes on a website where you can find out a little bit more. There's some more. So you will see it's each subject is a color-coded one. So these are just some examples of the tips about eating and drinking. Okay. Now, in terms of the development process, it was really, I think the best, in order to best to describe it, is to kind of show you couple of pictures. So we kind of all been there, sitting, thinking, how do I improve access to information? How do I make sure the needs of patients, in that case, somebody with profound and multiple learning disability, that their needs are met? How do I do that? And created a process of actually different professionals coming together in a group. It was done with colleagues from across the country who actually can feel that they've achieved something, they've been part of an exciting project and developed something that actually hasn't been there before on the market. So in terms of the process, that was like kind of short timeline. You're probably not going to see it because it's tiny. I do apologise, but you will see here we started in November last year. So I started with meeting with the developers to make sure that we had some scoping exercises in terms of what's available on an app, what platforms we can offer to, what would be the best format of this information, what the opportunities are, what are our limitations. And then throughout December till end of January 2013, that was a process of smartphone app development. Really was a matter of translating information on a paper-based copy into an app, because the booklet is pretty text heavy, so we had to translate it on a different format. And it was done in the form of WebEx teleconferences, where we had workshops on distilling content for an app, on making storyboard, kind of building it as we wanted. And then in February, March this year, we clicked published. Once the app is published, it takes few weeks to be actually live, to be put on app stores or Google stores to actually go live, because there's an internal process of making sure it's appable, as I've learned. So now we're in May, and we're in the process of launching it nationally through communication channels as NHS England. Now, just that's almost my last slide, is to talk about evaluation and feedback. We felt it was really important to allow that to happen, to find out who is using the app, what do they think about it. So when you go to the last screen of an introduction, it asks you to answer SurveyMonkey survey, which contains 8 questions. It looks like this. And we asked questions about who are you? You who is our end user, bearing in mind it's a free resource available to absolutely anybody. So it can ask you a question to say whether you're a family member, you're a carer, you're somebody with an interest, you're a health professional. If you are a health professional, then where do you work, what sector? So then we can get a feel of who actually uses that information, residential sector, acute hospital, GP. So it also allows some free text, just to give people opportunity to tell us what you think and how we could improve it. And that's it really. In your packs you will have this slide available, which includes the QR code. Depending on the phone that you've got, you need to first download the QR code scanner. So it's another app that allows you to scan those codes, and they take you direct to the app. I don't know whether anybody done it in a room with in a previous room. They already kind of done it, so it's already in your packs, and it takes you direct to the phone. So please, whether you've got a smartphone with an internet connection, please use it. Tell us what you think. Fill in the feedback, the SurveyMonkey feedback. So then we can start getting a feel of whether actually it works the way we hoped it's going to work, whether it achieved its aims. But that's it for me. Thank you.